I had my SCAD in August of 2019. And even with the 5 years that have gone by, I still experience a lot of stress and anxiety related to the SCAD.
Mhm.
I worry about having another SCAD. I worry about the effect that this is having on my family. Um, and I don't know what to do about it. And I guess I don't know. Is this normal?
First thing, absolutely. So you went through something big, and actually, SCAD survivors often talk about it being like a traumatic event,
Mm-hmm.
right? And so you think about that, you have to let your body heal, but also your mind to be able to sort of get around things so that you can get back to sort of a regular routine. And then even still, there's going to be some ups and downs when you're back to that regular routine, for sure. We also know that like 30 to 50% of patients who've had a SCAD will talk about having emotional stress before. So if you've
Mm-hmm.
had some of that emotional stress before, well, then of course it's not surprising to have some emotional stress after. And in the research where they've done, I guess really, looking at things like depression, anxiety, and stress after SCAD, we know that at least 15%, but up to 50 and maybe a little bit more percent of patients do have some of those symptoms. So certainly very normal. If in fact you feel like, they're sticking around and it's affecting your day to day, so you're not able to do your regular things because of the worries, like certainly sometimes you're tired and that's going to affect you to do certain things. But if it's the worries that are really impacting you, then I suggest always reaching out for help. It's one of the things that people, like you mentioned, often think about is the cardiac related anxiety, like having another SCAD.
Mm-hmm.
And so certainly we know that the rates are lower of recurrence than what we once thought they were, but that doesn't totally take away the worries. And so, and the people that tend to have more of those worries are those that are young, they're female, and certainly, if they have children, that's another area that sort of adds on some of those worries. So, like I said, it is normal. Give yourself some time. Let yourself ride that roller coaster because there's going to be those ups and downs, but still reach out if you need help.
Okay, so where can we go for help?
So it kind of depends where you are. So if you are a patient at the Heart Institute versus if you're somewhere else in Canada or the US or the world, here at the Heart Institute, certainly you can talk to your cardiologist. You can ask for a referral to some of the mental health specialists. So myself, for example, in psychology, as well as our colleagues in psychiatry, in cardiac rehab. We also have our social workers, our vocational rehab counselors that help with things like finances and return to work issues because that's sometimes something that people are grappling with. We also have a number of resources on our webpage. So, for example, I find that patients, when they learn a bit more about SCAD, that takes away, well, sometimes it depends where they're getting it, but hopefully reliable resources tend to bring down the anxiety a little bit.
Mm-hmm.
And so we have a great brochure, sort of a cardiac guide that we call them for SCAD on our website. There's also the Beat SCAD website, which is a great website from the UK that patients and clinicians have put together some amazing materials. In the US, there's one called SCAD Alliance. And actually, on that website, there is the SCAD Warrior app. I don't know if you've heard of that before.
No, I haven't.
So it's an app that was designed by a SCAD survivor who is also a psychologist. And so she developed an app that has 15 sessions where it goes through everything from SCAD information to, managing, ongoing chest pain to sleep. So it's just back up. It was up for a while ago, but now it's just back up. So it's available.
Oh, that's awesome. That would be a great resource because all of the things that you just said, the anxiety, the lack of sleep, all that kind of stuff,
Yeah.
are directly, for me anyways, correlated to, my SCAD event.
Yeah. The other ones I should probably say, if you're a patient here at the Heart Institute, is we do have, if you're a patient actually of the Women's Heart Clinic,
Yeah.
We have an education series. So they'll have different people coming, and sometimes, psychologists will go and talk to the group about some of their concerns. We also have a while you wait for cardiac rehab for specific for SCAD patients, and that's new. So anyone that's had a recent SCAD that's being discharged from hospital and they're coming into cardiac rehab, they'll be offered that. And actually that's available to anyone because it's an open session. So it doesn't matter if you're in the UK or if you're in Ottawa, you can attend that as well.
Okay.
And I think the other thing I should mention is the Women at Heart peer support program. Can't forget about that one. So again, this is for women,
Yeah.
but it is run by peers that have had heart events, and they do a SCAD specific group.
Yeah.
So
I've done one. It was a lifesaver.
super.
It was absolutely a lifesaver. What about resources for my family? I mean, as much as, all of this has affected me, and my day-to-day and my, because I do have angina, I do experience ongoing issues. I'm very fortunate to be followed by my cardiologist here at the Heart Institute, but my family have been affected as well, particularly my kids vis-a-vis their kids. I have grandchildren now, so
So you make a great point. Obviously, we recognize that a heart event doesn't just happen to one person; it happens to their whole sort of social system, and especially those that are closest to them. Most, of course, our resources are for the patient. However, we have been building on that recently because we recognize how important those loved ones are. So we do on the website now have a caregiver guide, is what we call it.
Okay.
So it's basically a guide for patients and their families about sort of tips for those that are helping out the patients, sort of obviously a reminder to take care of themselves, but also in learning. And certainly we suggest that they join any of our workshops that we have.
Oh, good. Okay.
So, the things that we have through cardiac rehab, we have a Mind the Heart video, for example. Certainly watch that along with the patient. And also when you mentioned the kids and grandchildren, we just now, it's going to be up on the website shortly, sort of a guide that says, how do you talk to your kids about heart disease? Because we do acknowledge it is difficult and it's hard to know depending on the age of the child. So we have a few tips in there, depending on the developmental age of the child, to help parents and guardians and other loved ones talk to kids about what's happened to, whether it be mom or grandma or dad or whoever it is.
Okay, great. I think those resources would be really helpful.